Hey everybody, thank you so much for tuning in. My name is Jiordana Saade and I'm a holistic nutritionist, and today's topic is on Alzheimer's disease. So Alzheimer's is a brain disorder, and it's actually the most common form of dementia. And Alzheimer's is a little bit tricky to talk about because we don't exactly know what the root cause of it is, and we also don't have a cure. So the emphasis really is on prevention here. So basically the brain is extremely complex. The neural networks that exist in the brain require so many moving parts in order to function properly. So essentially all the nerves in our brain send messages to the other nerves, which send messages to the entire body. And the messages are in the form of neurotransmitters. So in order for the neurotransmitter to be sent from one nerve cell to the next, there's a bunch of different moving parts that are associated with helping the actual brain to function. So since we don't know exactly what the root cause of Alzheimer's disease is, we do actually know that it is associated with damage to the nerve cells or the neuron cells. And the damage can happen in a number of ways. So it can happen through oxidative stress, which is essentially a dysregulation between free radical damage and a number of antioxidants in the body. So very closely related to inflammation levels as well as nutrient deficiencies, and diet and lifestyle, of course, as well as damage to the nerves can happen through plaque buildup and through tangles. So we're just going to talk about plaque and tangles a little bit. So basically plaques are a buildup of a protein called beta amyloid that can be found building up in between the nerve cells. And the tangles are twisted fibers of a protein called tau that can build up with inside the cell. So as we age, it is very normal for everybody to develop plaques and tangles in their brain. However, through autopsy, we've seen that people that have Alzheimer's disease tend to have a lot more buildup of both of those within the systems of the brain that regulate memory. So there is a connection. However, we can't exactly call it a causal connection quite yet. So everybody has lapses in memory from time to time, and so it's really nothing to worry about if you do have a lapse in memory. However, I will go through some of the signs and symptoms to look out for. So essentially repetition of questions and comments over and over again, as well as getting lost in familiar places and misplacing commonly used items like your keys or a book you're reading, forgetting appointments or meetings that happen like frequently within your schedule, and the final one is not being able to find the words. So that one's really common, but just some things to look out for if you are struggling with Alzheimer's disease, or if you suspect that it might be something that you or a loved one are struggling with. And so what can we do about it? So basically tons of stuff we can do with diet and lifestyle. So as far as lifestyle goes, we want to make sure that we're getting movement within the body. So movement is going to oxygenate the blood and oxygenate the brain, and it's going to send blood flow up to the nerve cells to feed the nerve cells, which is what we need. We need the nerve cells to be very strong and healthy. As well as diet, of course. So, increasing healthy fats in diet. The brain is 60% of fat. So we want to make sure that we're getting enough healthy fats in our diet, and in the form of, you could do fish, or you could do more plant-based like avocados or nuts and seeds. So actually walnuts are shaped exactly like the brain, and that's a nice little sign from nature that it is going to help the brain function. And then gearing more towards an anti-inflammatory diet again. So removing processed foods, inflammatory items like sugar and dairy should be taken out of the diet, and alcohol as well. And if you are a smoker, that would be another thing to eliminate from your diet. And then as far as supplements, I have chosen 3 really great ones here today. So the first one is the omegas, which we've talked about so many times before. If you didn't check out the eye videos, you should check them out, because anything that's going to help the eyes is going to also help the brain, because the two systems are very closely connected. So the omegas are healthy fats. So again, it's literally the building blocks of the brain, because the brain is made up of fat, as well as they're going to be very anti-inflammatory. So it's going to help to reduce the inflammation from any of that oxidative stress that we just kind of talked about. And then moving to GINKGO. So again, I talked about this one with eye health, but GINKGO is a cerebral spinal dilator. So it's going to help to dilate the blood vessels and send blood and nutrients up to the brain to feed the nerve cells and the brain. And then the last one is lecithin. So this one's really cool, and we haven't talked about this one before. So lecithin actually is another part of a building block of the brain. So outside of every one of our nerves is something called the myelin sheath. And the myelin sheath is this protective layer of the nerve cells. And when the myelin sheath becomes denatured or becomes damaged, then the transmission of the message, that the signal that the neurotransmitter is sending to the next nerve cell, it can get lost in transmission, or it can just be transmitted much slower. So lecithin is going to help to protect the integrity of the myelin sheath, which is going to allow for transmission to be much quicker. So this is really good for things like memory recall. So when you are having trouble recalling something that you've learned, if you put lecithin in your diet through supplementation or through diet, then you're going to notice that that memory recall is much quicker. This is something that I actually use and I used all through school. And one of the reasons it's important to supplement with lecithin instead of just getting it in the diet is lecithin is actually also used very prominently in the liver for detox. So when we have lecithin in our diet, most of it goes towards the liver. So we want to make sure that we're kind of going over and above if we want to be helping brain health and making sure that the brain has all of the tools that it needs. So I hope you guys liked that video. If you have any questions, please link it up in the comments below. I'd be happy to answer them. Next week, we're going to talk about another brain disorder, so stay tuned and don't forget to like, comment, and subscribe. Thanks, guys.